I'd also like to ask you to bring a major lawsuit against the drug companies on opioids. Some states have done it, but I'd like a lawsuit to be brought against these companies that are really sending opioids at a level that it shouldn't be happening.
That was President Trump on Thursday urging Attorney General Jeff Sessions to sue drug companies that have contributed to the opioid epidemic in the United States. The president also urged the Attorney General to take legal action against foreign companies, especially from China and Mexico, that have contributed to the deadly flow of fentanyl into the United States. All that as the Centers for Disease Control and Prevention released bleak new figures on the opioid crisis. The CDC estimates a record 72,000 Americans died from drug overdoses last year. That's nearly 200 people every day. That's a 10% increase in just 1 year from 2016. By contrast, just over 40,000 people were in motor vehicle crashes last year. This chart shows the staggering growth in overdose deaths from about 17,000 people in 1999 to 72,000 people in 2017. Two factors are blamed: a growing number of Americans using opioids and the drugs becoming more deadly. The CDC says overdose deaths rose sharply in several mid-Atlantic and Midwestern states. Those states, Ohio, Indiana, West Virginia, and New Jersey. But the picture's not bleak everywhere. The number of overdose deaths fell in Massachusetts, Vermont, and Rhode Island, where the opioid crisis arrived early. And each of those states now has major public health campaigns and has increased funding for addiction treatment. Joining me now is Beth Macy. She's the author of a new book on the opioid crisis, Dope Sick: Dealers, Doctors, and the Drug Companies That Addicted America. Beth, good to see you again. Thank you for being with us.
Thank you for having me.
You tracked the opioid crisis from its origins largely in Appalachia more than 20 years ago to this nationwide epidemic today. Is the Department of Justice the place where this can get stopped?
I don't believe so. I believe what we really need is leadership and a plan for helping the 2.6 million people with opioid use disorder get easy access treatment. We have a judge, a federal judge, a very qualified federal judge in Cleveland named Dan Polster, who's already overseeing more than 1,000 lawsuits. And he has said that if every locality, every government, and every governmental body in our nation keeps suing the opioid distributors and makers, they're going to go bankrupt. What we need now is leadership and a plan for treatment.
There are some people who are listening to this who probably say, so what's wrong with them going bankrupt? The fact is, I hear from people every time we do this topic that there are people who actually use these drugs responsibly, and they're needed for pain management. So we have to find some sort of happy medium between overprescribing and having people selling drugs and getting the right drugs to people who actually need them.
That's absolutely right. And I agree with President Trump when he says we need to stop the fentanyl coming in from India and China. And, you know, in my town, in Roanoke, Virginia, kids are being arrested selling fake Xanax bars that are actually fentanyl that have been brought in from the dark web from India and China. And I think he's right on that point. But more importantly, we're not talking about these 72,000 deaths that we had last year, largely related to fentanyl and other synthetic opioids. And if you look at those states where they did start to make a slight decrease, those are the states that got on board early with the Medicaid expansion, got hub and spoke treatments, got ERs to start prescribing medication-assisted therapies, got syringe exchange and recovery programs in their communities. And that's really what I believe we need to be talking about right now.
For those 2.6 million people who have an opioid issue, is there treatment and a cure that is proven for all of them?
Well, medication-assisted therapy, mainly buprenorphine and methadone, have been shown to reduce overdose deaths in more than 50% of cases. It's still a tough disease to get over. John Kelly out of Harvard says it takes a typical opioid-addicted user 8 years and 5 to 6 treatment attempts.
Wow.
So they're not perfect medications, but right now they are the best tools we have in the toolbox, and we need to start making users have easier access to them.
Beth, thanks very much for joining us again. Beth Macy is the author of Dope Sick, Dealers, Doctors, and the Drug Company That Addicted America. If you or anyone you know needs help related to opioids, you can call the National Helpline at 1-800-662-4357. That's 1-800-662-4357. You can also go to hhs.gov/opioids. The center can direct you to treatment centers and other resources. Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.